Hello, my mental health champions. Welcome again to another time with Jay Kelly, your nurse practitioner. And on this channel, we talk about everything mental health. And today we're going to be talking about something very important that affects everybody: insomnia. Yep, where are those my night out? So if this is your first time logging into this channel, I would like you to go ahead and smash the subscribe button, like, share, and comment. And today I would like you to comment below and let me know, who do you think insomnia affect the most, men or women? So I would like my girls and my boys to get on there and let me know, who do you think will suffer more from insomnia. So what is insomnia? We will not talk about it without first of all defining what insomnia is all about. Insomnia is a sleep disorder. By the way, a disclaimer, I am not a sleep specialist. I am a psychiatric mental health nurse practitioner, but these are some of the things we treat in practice. Insomnia is a sleep disorder in which you have trouble falling or staying at sleep. So the condition can be short-term, which we will term it acute, or long-lasting, which will be say chronic, or it can also be intermittent, though it comes and goes. So acute insomnia can last from one night to a few weeks. And chronic insomnia can happen at least 3 nights a week for about 3 months or more. So we have types of insomnia. What are the types of insomnia that we know or we see? We have primary and secondary type of insomnia. What is the primary type of insomnia? This means your sleep problems is not linked to anything related to any medical condition or any other problem. So that's your primary type. And what are your secondary type of insomnia? This means you have trouble sleeping because of a health condition, like asthma, depression, arthritis, cancer, anything, heartburn. Yeah, maybe you ate a heavy meal and you're having that indigestion and it's keeping you awake at night. It can be pain medication or alcohol, substance use. All of these can trigger a secondary insomnia in people. So you might also hear people talk about a sleep onset insomnia. This means you have trouble getting to sleep. You have sleep maintenance insomnia. This happens when you have trouble staying asleep through the night or wake up too early. You also have mixed insomnia. With this type of insomnia, you have trouble both falling and staying asleep through the night. You have paradoxical insomnia. When you have paradoxical insomnia, you underestimate the time you are asleep. It feels like you have slept a lot or less than you really do. Now, let's go into the causes of insomnia. Let's start with the primary causes of insomnia. The primary causes of insomnia can be stress related. You will be like, oh, she talks about stress. Stress, embodies a lot of things and can cause many other mental health issues in our body. So stress is related to a big life event, like a job change or a job loss, a death in the family, divorce, moving, or even back to school, as we are having back to school. Yes, that can make you to lose sleep at night. Things around you like noise. Maybe you're living close to a railway. You're living close to a construction site that do construction 24/7. Maybe you're living close to a major road. It can cause all these noises, disturbance to make you to stay awake at night, that you can't stay asleep or fall asleep very easily. You can have problems with light. Lighting in the room can constitute a primary cause of insomnia. Why? Let's say the light on your phone, the light on the TV. That's why we discourage TV in the bathroom. The bathroom should be a place of quietness where you go there, you just want to hit the sack and close your eyes and go to sleep. So the light from the TV, light from your phone, or even the light, just coming into the bathroom, you might need some dark curtains in the room so that you can fall asleep very easily and stay asleep. Temperature can also constitute a primary cause of insomnia. If you like me and my family, we always fight on the thermostat. Some people want it hot, some people want it cold. That will keep the people that want it hot. If we crank the temperature up, some people that want it cold will want to be, will not be able to sleep, or vice versa. Temperature can constitute a primary cause of insomnia. So there might also be a sleep schedule change. Maybe you travel out of the country where your sleep schedule has been messed up a little bit. You face what we call jet lagging. Like me traveling to Africa, the first few days is not funny. I face jet lagging because we have that big time difference, like 6 hours time difference. So your circadian rhythm is kind of messed up a little bit. You have a new shift at work. Where I'm a night shifters, yeah, maybe you work night shift and now you want to switch to day shift. Things like that. A new shift at work can constitute a primary cause of insomnia, or bad habit you've just picked up, from friends, or from just bad habit you picked up from yourself. That can, constitute a primary cause of insomnia. Your genes, your genes. Research has found that a tendency of insomnia may run in families. You might want to ask around, maybe want to ask your daddy or your mommy to be like, do we have people in my family, or do you suffer from insomnia? We realize that there are some genes that can, lead to you suffering from what your parents or from what your relatives suffer from. So those will be the primary causes of insomnia that we see. Now we will move to the second part of it. The secondary part of this will be the secondary causes of insomnia, which may include mental health disorders like anxiety, depression, ADHD, those people who suffer from insomnia, or medications for cold, allergies, high blood pressure, asthma. We talk about that. Pain or just discomfort in your body, indigestion. All of those are secondary causes of insomnia. Caffeine. Where are my coffee drinkers? Yeah, you drink coffee too much that you can't go to sleep. I know people, colleagues, I'll be like, I don't care. I can drink coffee right before bedtime and I will go to sleep. But we really, really discourage you to have that last cup of coffee right before bedtime, because research has found that coffee can stay in your system for more than 9 hours. Yeah. So you don't want to drink that last cup of coffee right at 7 p.m. or right before you hit the sack, because that might keep you awake. Alcohol. So if you are somebody who love to, a booze, please, 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 please don't drink it like right before you go to bed, because that can constitute a secondary cause of insomnia to you. Drug use. Yeah, some people that use drugs, illicit drug use, it can constitute a cause of insomnia to you. Hyperthyroidism or any other endocrine disorder can make you to stay awake at night and not be able to fall asleep. Other sleep disorders like sleep apnea, restless leg syndrome, it can constitute a cause for you not to be able to fall asleep. We have pregnancy. Where are the mamas in the house? Pregnancy, you know how difficult, especially in your third trimester, it is difficult for you to be comfortable and go to sleep. Why? Because you can't breathe. You don't have any comfortable position. Pregnancy can be a secondary cause of insomnia to those mamas. And we also have cognitive disorders like Alzheimer's disease. We have other types of dementia. Dementia will make people not to go to affect your sleep. So this is a secondary cause of insomnia. We have menopause. Those going through menopause, they have problems sleeping because you're either too hot or too cold. You get hot 1 minute, you get cold the second minute. So it might mess up with your sleep schedule, that it makes you not to fall asleep as you will want to. So this will be it for today. We'll continue to talk about this insomnia and see how we can treat insomnia, non-pharmacologically and pharmacologically in our next video. And don't forget to comment below and let me know if you suffer from insomnia. Let me know some of the things you do that helps you fall or stay asleep, and I'll be more than happy to discuss that with you next time. Have a wonderful day. Don't forget to share, subscribe, and comment below. Love you and have a good one.